Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is Sphenoidal Sinuses, free medical education. The paranasal sinuses. They are air-containing cavities in the bones around the nose. There are 4 pairs altogether, 4 in number on each side of the skull. This is anterior view of the skull. This is left lateral view of the skull. We have 4 pairs of paranasal sinuses. This is frontal sinuses, which are high up in the frontal bone. And next is sphenoidal sinuses. It is in the body of the sphenoid, far deep inside. Next is ethmoidal sinuses. They are in the lateral mass of the ethmoid bone. On each side, 3 groups of air cells, anterior, middle, and posterior. And finally, the maxillary sinus, which is the lowest but the biggest in the body of the maxilla. So if you see from lateral side, this is the frontal sinus high up in the frontal bone. This is the sphenoidal sinus far back in the body of the sphenoid. Ethmoidal sinuses, 3 groups on each side, anterior, middle, and posterior. And maxillary sinus, the lowest but the biggest and most clinically important inside the body of the maxilla. Sphenoidal sinuses. This is the body of the sphenoid bone, mid-sagittal section. This is sella turcica, occupied by the pituitary gland. This is optic nerve. This is sphenoidal sinus. Sphenoidal sinuses are a pair of sinuses located in the body of the sphenoid bone. Very often, sphenoidal sinuses are asymmetric. The septum is seldom in the middle, occasionally incomplete or deficient. Thus, the size of the sphenoidal sinuses varies from small to very large, occupied the anterior part of the body of the sphenoid to the entire body of the sphenoid. Osteum, opening of the sphenoidal sinus. We are looking the inner surface of right nasal wall. This is in front. Let's identify few structures. This is body of the sphenoid. This is sphenoidal sinus. This is cribriform plate of ethmoid bone. This is superior turbinate. Between these 2 structures is a passage called sphenoethmoidal recess. So where is the osteum, the opening of the sphenoidal sinus? Here is in anterior wall of the sphenoidal sinus is the sphenoidal opening. It opens into sphenoethmoidal recess between cribriform plate and superior turbinate. Relations of the sphenoidal sinuses. The diagram is the mid-sagittal section of the sphenoidal sinus. Sphenoidal sinus is related to many structures. Superior and anteriorly, olfactory tract, optic chiasma, frontal lobe in the anterior cranial fossa. Superior and posteriorly, pituitary gland in sella turcica. Laterally, cavernous sinus with the internal carotid artery, cranial nerves 3rd, 4th, 6th, and 1st and 2nd divisions of the trigeminal cranial nerves. We'll see in next slide. Posteriorly, middle cranial fossa, basilar artery and the brainstem. Inferiorly, nasopharynx, pharyngeal lymph nodes, and anteriorly, nasal cavity. Sphenoidal sinus in relation to the cavernous sinus. This is a pair of sphenoidal sinus in the body of the sphenoid bone. Above is the pituitary gland. Lateral to the pituitary and sphenoidal sinus is the cavernous sinus, number 1. Inside the cavernous sinus, we have an internal carotid artery and 6 cranial nerves. Number 2. On the lateral wall of the cavernous sinus, you can see here oculomotor nerve, that is the 3rd cranial nerve, trochlear nerve, 4th cranial nerve, and then below is ophthalmic, V1, and maxillary, V2 divisions of the trigeminal nerve. The 6th cranial nerve is inside together with the internal carotid artery. Infralateral to the sphenoidal sinus is the pterygoid canal with the nerve of pterygoid canal, also known as Vedian nerve. Let's see the diagram in these slides. This is the mid-sagittal view of the body of the sphenoid. This is the body of the sphenoid below the pituitary fossa. It is occupied by sphenoidal sinus. This is optic nerve. Onody cells. Onody cells are posterior most air cells of the posterior ethmoidal sinus. They are located within the body of the sphenoid. This is onody cells located in the body of the sphenoid. In X-ray of the body of the sphenoid bone, if 2 cavities exist above and below with the transverse septum DS between them, the cavity above is onody cells. It is separated from the sphenoidal sinus below it. Clinically, what is important is in about 11.7%, the optic nerve passes through the onody cells which has dehiscence. Take note and care that internal carotid artery and central artery of retina may also be enclosed in the onody cells. So it is dangerous during sphenoidal sinus surgery. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Free medical education. See Anatomy DAHAR series, Paranasal Sinuses, Blood and Nerve Supply, Embryology and Functions. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.